scoot down towards me. Extension, okay. And then side bending access to the nose, and you're feeling for the closure on the same side. Then we go to C1, C2. You feel for the opening or the closing for extension. Again, access to the ears. And then for rotation, you're bringing the head up, locking out the mid-cervical spine, and you check. And you should have a nice capsular end feel, and it should be equal. Usually people can get to their axillaris. Okay? The other way you can feel it is you can rotate to the head to the right, and as C2 kicks to the left, the spine is processed, you know C1's done rotating on C2, so then you know C1 is how much rotation, and he gets right about there, which is good, about 45 degrees, which is what you expect. When I rotate him to the left, I should feel that, again, that spine is processed as C2 kick to the right. As soon as C1's done rotating on C2, C2 starts to rotate. Make sense?
Yep.
Mm-hmm. All right, now we're done with the upper cervical spine. We're down to the mid-cervical spine. So I recommend checking down glide and up glide. How I check down glide is with side bending. So you're going to feel the foramen, and you're going to feel that close. Okay? You can do, I do this quick, but please do it slow. You can do a couple, 3, 4, 5 times per segment. You can come back up the spine, okay? And he's a little stiff towards the bottom. He's pretty loose in through the middle. That's how a lot of people are. Okay. And then we do the same thing to the left. That was down glide. And then for up glide, I'm feeling bilaterally. I'm feeling opening. Again, the foramen, so you're lateral. You shouldn't be posteriorly. You can do this posteriorly, but you have to feel the facets. It's much harder.
Okay.
It's so much easier to feel those foramen open. Okay? That's C occiput to C7.
Okay.
That's it.
That's it?
That's it. Okay.
I know. It seems like there's more.
All right. Now, well, there's the precautionary test, and then there's the distraction. Okay?
Yeah, well, the distraction.
That's the treatment, but that's a mobility test. That was it.
Okay.
That's all you have to do.
For
Okay?
that mobility. Okay.
So now we have distraction. You're going to grab the top segment. So I'm on C3. You're going to grab the segment below it, which is C4. Your fingers should be touching. My right hand's the top hand, so that means that
right foot's
forward, and my right shoulder's on his forehead, not here, on his forehead. And I'm going to use my shoulders to pick his head up. So first I'm going to distract by pulling out the top of his head towards my belly, and then I'm going to lift.
So that's where your shoulder's coming in.
Mm-hmm. So this is an unbelievable technique to inhibit guarding and pain in the cervical spine.
Okay.
Decompress the facets, change the dynamics on the disc. If this hurts a patient, it's usually a sign they either have a really bad herniated annulus, tear in the annulus, which is part of the capsular ligamental structure, or they have a bad facet capsulitis.
Okay.
Okay? This, for most of your patients, is going to feel fantastic.
Yeah.
They're going to please pull on my head all day. They'll feel like a weight's being taken off of them. They'll feel like a
Right.
pulling, a stretch, but a good stretch. All of this is great. This is the go-to technique for scaling guarding, any kind of guarding in here. Okay? The other one in the book that we went over is just a simple little down glide, where you take this part of your hand up on the front part and you just down glide it a little bit by just pushing that way. And that's a good technique just to oscillate or do a hold to help with right rotation, right side bending, or extension.
Okay.
Because it's down glide.
And that you're starting at 3. C3?
C2. You could do this at 2.
You could start at, okay.
Yeah. You could do the distraction all the way up to occiput C1.
Right,
You know,
yeah.
They have a lot of upper cervical stuff, and the distraction's not working. I recommend getting them to a PT.
Yeah.
But just for some of this mid-cervical stuff, you do a little oscillations or one stuck, and you do a grade 4 hold, and it loosens up for you. It might be something you can treat in conjunction with whatever they have going on in their arm.
Okay.
If it's only a neck problem and no presentation in the arm, I mean, that's rare. You're going to see that anyway. But
Right.
like, let's say you get the elbow better and they're still having neck issues, I would refer them to a
Right.
PT.
Right.
But while you're treating their upper extremity problem, treating the neck in conjunction with this can help the arm,
Right.
and as well as help resolve maybe what's driving this arm stuff to begin with. And a lot of times they don't have the insurance or the ability to see 2 people in the same hour.
Right. Right.
So, so that's the thought.
Okay.
Okay, so...
All right, let me try.